Hi everyone, welcome back to Learning English Pro, the channel for healthcare professionals like you who want to excel in English and pass the OET exam. In a recent study, it was found that by having a good reading strategy going into the OET, you can improve your final score by up to 20%. That's the difference between passing and having to resit. So, if you have any anxieties about the reading segment of the OET, you're in the right place. My name is Jer, I'm a CELTA-trained English teacher, and I'm delighted to walk you through my OET reading masterclass. Over the next 10 minutes, we'll go through the entire OET reading segment of the exam, and I'll give you actionable tips to help you improve your reading skills and strategies to ace this part of your OET journey. Student members of my channel should head over to the membership tab to download a PDF guide for this lesson. It includes 2 full OET reading examinations that you can time yourself and take the test for great practice. If you want to join student membership with Learning English Pro, the link is in the video description. You'll gain access to tons of learning materials and PDF guides for each new lesson. So if you're ready, grab a pen and paper and let's get started on your OET reading journey. First things first, let's understand what the OET reading exam actually involves. It's a 60-minute subtest designed to assess your ability to read and understand different types of texts commonly encountered in the healthcare profession. Part A is all about speed. You have just 15 minutes to answer 20 questions based on 4 short texts on a single medical topic. Your main goal here is to quickly locate specific information. For parts B and C, you'll have a combined 45 minutes. In Part B, you'll encounter 6 short texts, around 100 to 150 words each, taken from workplace contexts. For each text, you'll answer one multiple-choice question focusing on the main idea, the purpose, or the writer's opinion. Finally, Part C consists of 2 longer texts, each followed by multiple-choice questions that delve deeper into the writer's opinions, attitudes, and the finer details. Alright, let's dive into Part A, the initial sprint against the clock. Many students find this challenging because of the time constraints. But don't worry, with the right strategies, you'll soon become a scanning pro and be able to find the information that you need quickly. Understand the questions first. Before you even look at the text, read and understand the questions. This will tell you exactly what you're searching for. Identify key words in the questions. Underline or mentally note the key nouns, verbs, and numbers in each question. These are your targets. Scan the text, don't read every word. Think of it like using a search engine. Your eyes should quickly scan the text, looking for your keywords or synonyms. And that brings us to our next tip. Look for synonyms and related terms. Medical English often uses different words for the same concept. Be prepared for synonyms. The correct answer is unlikely to use the exact same words as the text. It will often be paraphrased. And most importantly, practice time management. Allocate a specific amount of time for each question and move on if you're stuck. Don't let one question eat up all your time. You can always come back to it if you have time at the end. Now, let's shift our focus to parts B and C, where careful reading and deeper understanding are crucial. These sections test your ability to get a grasp on the main ideas, specific details, and sometimes even the writer's opinion. Let's check out some key strategies. First up is to identify the main idea of the text. For each text, ask yourself, what is the writer's primary message? Look for topic sentences and recurring themes. Our next important strategy is to pay attention to linking words throughout the text. Words like however, in contrast, furthermore, signal shifts in meaning or connection between ideas. Familiarize yourself with the different types of questions asked in parts B and C. Knowing what you're being asked to find will guide your reading. Don't just passively read, engage with the text, highlight key information, underline important details, and jot down notes in the margins. This active approach will boost your comprehension, especially in the longer texts of Part C. You won't understand every single word. Focus on understanding the main idea and the information needed to answer the questions. Use context clues to infer the meaning of unfamiliar words. Don't let a few unknown words derail you. Let's quickly see these strategies in action. For Part A, if the question asks about a medication to avoid, or perhaps a piece of equipment, like we have on screen here, quickly scan the text for the same terms or perhaps synonyms of these terms to find what you're looking for. For Part B, remember to identify the main idea and the writer's purpose. Part B often tests your understanding of whether a text aims to warn, advise, or suggest. Look for language that signals the author's intention. In Part C, you'll need to understand not just the details, but also the writer's stance. Pay close attention to the language used. Are they expressing approval, disapproval, or uncertainty? Words like however, crucially, or strong adjectives can give you clues. So there you have it, a complete guide to mastering the OET reading examination. Remember, understanding the format, practicing effective strategies, and building your medical vocabulary are all key strategies in order to pass and master this test and achieve your professional goals. If you found this lesson helpful, make sure to subscribe to Learning English Pro. And if you want to join the student membership and gain access to the PDF guide for this lesson, the link is in the video description. Student members, head over to the membership tab to start downloading your guide. And stay tuned if you want more OET. Coming up is my OET listening challenge. Can you pass the test? Think you've mastered OET listening? Here's your challenge. Can you follow 10 real-life doctor-patient conversations that get harder and harder as they go? If you're aiming for top marks, this is the lesson to push your skills to the next level. Hi, I'm Jer, and this is Learning English Pro, the channel for healthcare professionals like you to excel at English communication and prepare for exams like the OET. This lesson is a listening quiz, and it covers medical English conversations on topics such as healthcare, symptoms, and treatments. Actually, it's perfect for anyone interested in improving their English. And here's the challenge. As we move through the lesson, the conversations will get harder and harder. Each conversation will feature two characters, a healthcare worker like a doctor or nurse, and a patient. The difficulty will increase in terms of vocabulary, language complexity, accents, and context. Each conversation includes two tricky questions focused on symptoms, treatments, and severity, and patient concerns. Questions will stay on screen, no distractions, and I'll reveal the answers after each conversation. And it's up to you how you want to approach this lesson. If you're interested in active learning, listen to the lesson in full. Find a quiet place to do this. Have a pen and paper ready to take down your answers, and repeat the lesson a few times. Repetition is key. Or maybe you're into passive listening. If that's the case, go about your daily routine and have this video playing in the background. It's a great way to learn medical English with natural listening skills. Student members of my channel can take their learning even further with my exclusive PDF guide for this lesson. It includes full transcripts for each conversation, 6 additional questions per dialogue, and extra exercises like AI homework to replicate the real OET experience. If you'd like to join the student membership and gain access to these amazing perks, click the link in the description below. Alright, let's get started with our first conversation. Grab a pen and paper and pay close attention. Conversation 1.
Good morning, Mr. Jacobs. How are you feeling today?
Not so great, Doctor. I've been feeling really under the weather for a few days now.
I'm sorry to hear that. Can you tell me about your symptoms?
Well, I've had a cough that just won't go away, and I've been feeling very tired. I also have a sore throat and a bit of a fever.
I see. Have you noticed any other symptoms? For example, a runny nose or muscle aches.
Yes, both. My nose has been very stuffy, and my whole body feels achy, especially in the mornings.
That sounds uncomfortable. Have you been drinking plenty of fluids and getting enough rest?
I've tried, but I'm finding it hard to sleep at night because of the cough.
I understand. It sounds like you may have the flu. I'd recommend plenty of fluids, rest, and over-the-counter medication to manage your symptoms. If the fever lasts more than a few days or gets worse, please come back to see me.
Thank you, Doctor. I'll do that.
So that is our first conversation out of the way. How did you get on with the questions? Question 1. What are Mr. Jacobs' main symptoms? The answer is cough, tiredness, sore throat, and fever. Question 2. What does the doctor recommend Mr. Jacobs do? Answer. Drink fluids, rest, take over-the-counter medication, and return if the fever worsens. Great, let's move on to conversation 2.
Good afternoon, Kimberly. What brings you in today?
Hi, doctor. I've been feeling really unwell for the past few days, and it's getting worse.
I'm sorry to hear that. Can you describe your symptoms?
Well, it started with a headache and a bit of a sore throat, but now I've got this horrible pressure in my sinuses, and I feel congested all the time. My nose is completely blocked.
That sounds uncomfortable. How's your energy level?
I'm completely drained. Even simple things like getting out of bed feel like a chore.
I see. Would you say the sinus pressure is your worst symptom?
Absolutely. It's constant, and it's giving me these sharp pains around my eyes and forehead.
I understand. Have you tried taking any medication or remedies so far?
Just some paracetamol for the headache, but it doesn't help much.
Okay, it sounds like you might have a sinus infection. I'll prescribe a nasal spray and some decongestants to relieve the pressure. You should also keep taking paracetamol for the headache.
Thank you. How often should I use the nasal spray?
Twice a day, morning and evening. If you don't see improvement within a week, come back and we'll reassess.
Got it. Thanks, doctor.
Did you manage to find the answers to the questions? Question 1. Which symptom does Kimberly find the most difficult to manage? The answer is the sinus pressure, which causes sharp pains around her eyes and forehead. Question 2. What form of medication does the doctor prescribe to help with Kimberly's symptoms? The answer is a nasal spray and decongestants. It's time for conversation number 3.
Good morning, Mrs. Davies. How are you feeling today?
Oh, good morning, Doctor. I'm afraid I'm feeling rather poorly. I've been under the weather for about a week now.
I'm sorry to hear that. What symptoms are you experiencing?
Well, my chest feels tight, and I have a nasty cough that keeps me up at night. And, to top it all off, I feel as weak as a kitten.
That does sound unpleasant. Have you noticed any shortness of breath?
Yes, especially when I go upstairs. Even a short walk leaves me feeling winded.
I see. Do you live alone, or is someone around to help you if needed?
My son, Richard, checks in on me every evening, and he's been quite a blessing lately.
That's good to hear. I'd like to prescribe an inhaler to help with your breathing and some medication for the cough. Do you have any allergies to medication?
None that I know of, Doctor.
Excellent. Use the inhaler twice a day, and let's see if that eases your symptoms. If the shortness of breath gets worse, please don't hesitate to call us or visit the hospital.
Thank you, Doctor. I'll do just that.
Let's check out the answers to our 2 questions for conversation 3. Question 1 is, how does Mrs. Davies describe her overall strength levels? She says she feels as weak as a kitten. This is a common English idiom used to describe when someone is feeling unwell and not very physically strong. Question 2. Who has been helping Mrs. Davies during her illness? The answer is her son Richard. He checks in on her every evening. Let's increase the difficulty slightly with our next conversation, number 4.
Good afternoon, Mr. Clark. How are you feeling today?
Afternoon. I'm fine, I guess. Just a bit tired lately.
I see. Tiredness can come from a lot of things. Have you been eating well?
I've had a bit here and there. I'm not really hungry much these days.
When you say here and there, what did you have to eat yesterday?
Let me think. I had a slice of bread in the morning, and I think I picked at some soup in the evening. I didn't really finish it, though.
That's not much food for a whole day. Are you finding it hard to eat, or do you just not feel like it?
I just don't feel like eating, to be honest. Everything seems unappealing.
Have you noticed any other changes, like feeling hotter than usual or sweating at night?
Actually, yeah. I've been waking up drenched in sweat the past few nights, and during the day I feel flushed sometimes.
That could indicate an infection. Have you been feeling any pain or discomfort anywhere?
My stomach has been a bit off. It feels heavy, like something's sitting in it, but it's not painful.
I'll take your temperature and check your vitals now. It's important to stay hydrated, even if you're not eating much. Have you been drinking enough water?
I suppose so, but not as much as I probably should.
That's something we'll keep an eye on as well. Once I've checked your vitals, I'll speak with the doctor about your symptoms and get you some fluids if needed.
Thanks. I didn't think it was anything serious.
Let's check out the answers to the questions for conversation 4. Question 1. What does Mr. Clark's recent diet indicate about his health? The answer is his minimal food intake and lack of appetite suggest potential malnutrition or an underlying illness. Question 2. What symptoms suggest that Mr. Clark might have an infection? The answer is night sweats, feeling flushed, and a heavy feeling in his stomach. We are already on conversation number 5. Well done. Don't forget to take a break if you need one.
Good morning, Ms. Patel. What seems to be the issue today?
Good morning, Doctor. I've been feeling very strange lately. It's hard to explain, but I've been getting these random dizzy spells and this tingling feeling in my hands and feet.
That does sound unusual. How long have you been experiencing these symptoms?
It started about 2 weeks ago, but it's been getting more frequent over the past few days.
I see. Have you noticed any triggers, like certain activities or times of day when it happens?
Not really. It just seems to come out of nowhere. One moment I'm fine, and the next I feel like the room is spinning.
Do the symptoms last long, or do they come and go quickly?
The dizziness only lasts a few minutes, but the tingling can stick around for hours.
Have you had any other symptoms like headaches, nausea, or vision problems?
Well, I've been having a bit of trouble focusing my eyes sometimes, but I thought it was just because I was tired.
That's helpful to know. I'd like to run a few tests to check your balance and reflexes, but we may also need to schedule a CT or MRI scan to get a clearer picture of what's going on.
A scan? Do you think it's something serious?
It's too early to say. The scan will help us rule out anything major, like nerve or brain-related issues, so we can narrow down the cause of your symptoms. It's a precaution.
All right. If it helps figure this out, I'm fine with it.
Our medical conversations are definitely getting a bit more tricky. Let's check out the answers to the questions for conversation 5. Question 1. Why does the doctor decide to schedule a scan for Miss Patel? The answer is to rule out major issues like nerve or brain related problems and narrow down the cause of her symptoms. Question 2. What unusual symptoms does Miss Patel describe? Answer. Random dizzy spells and a tingling feeling in her hands and feet. Let's move on to conversation number 6.
Good morning, Mr. Whitaker. What's brought you in today?
Morning, Doc. I'm feeling proper rough. Me tummy's been giving me jip for weeks now.
I see. When you say your tummy has been giving you jip, can you describe exactly what you mean?
It's like this gnawing pain right in the middle here. Feels like someone's twisting a knife in me gut. Comes and goes, but when it's bad, it's bad.
That doesn't sound pleasant. Have you noticed if certain foods or drinks make it worse?
Well, I love a good brew, but lately, a cuppa's been setting it off something awful. Same with spicy food.
That's good to know. Have you had any other symptoms, like nausea or a burning feeling in your chest?
Nausea, sometimes I feel like I'm going to chuck, but I never do, and now and again I get this sour taste in me mouth. It's proper rank.
It sounds like you might have an ulcer. I'd like to send you for a test to check for that. It could be caused by stomach acid irritating the lining of your stomach.
An ulcer? Sounds nasty. Is it that serious?
It's treatable, but we need to confirm it first. If it's an ulcer, we'll give you medication to reduce the acid and allow it to heal. In the meantime, try to avoid tea, coffee, and spicy foods, as they can aggravate the symptoms.
I can give that a go. Reckon I'll miss me brew, though.
I understand. Let's get this sorted so you can get back to enjoying it soon.
The patient in this conversation definitely had an interesting accent. For our first question, what slang term does Mr. Whitaker use to describe his stomach? The answer is he calls it his tummy. Question 2. What does the doctor recommend Mr. Whitaker avoid to reduce his symptoms? The answer is tea, coffee, and spicy foods. Are you noticing the increase in difficulty in the conversations? Let's check out conversation number 7.
Good morning, Mrs. Turner. What seems to be troubling you today?
Morning, doctor. I've been so worried. My face has been feeling strange for the past few days. It started with this stinging pain, like a tingling across my forehead and around my eyes. Now I've got these awful little sores.
I understand your concern, Mrs. Turner. Let me have a closer look at those sores around your eyes. Have you noticed any changes in your vision?
Not really, but my eye feels a bit irritated, like it's dry or itchy. The pain is the worst part. It feels like little needles under my skin. What's happening to me, doctor?
From what I can see, and based on your symptoms, this looks like shingles, also known as herpes zoster. It's caused by the same virus that causes chickenpox. Have you ever had chickenpox before?
Yes, when I was a child. But shingles? I've heard of it, but I didn't know you could get it on your face. Is it serious?
It can be uncomfortable, but it's treatable. Shingles around the eye, however, need special attention because it could potentially affect your vision if left untreated. I'll prescribe antiviral medication to help your body fight the virus, and we'll keep a close eye on your symptoms.
My vision? Could I go blind?
It's very unlikely, Mrs. Turner, especially since you've come to see me early. The medication will help, and I'll refer you to an eye specialist just to make sure your eye itself isn't affected. You're in good hands.
Thank you, doctor. I've been so anxious. I didn't know what was happening to me.
That's completely understandable. Shingles can be alarming, especially when it's near the eye. Take the medication as prescribed and rest as much as possible. We'll monitor your progress, and I'll be here if you have any concerns.
I'll do that. Thank you so much, Doctor.
Let's check out the questions and answers for Conversation 7. Question 1. How does Mrs. Turner describe the pain on her face? The answer is, she describes it as a stinging, tingling pain like little needles under her skin. Question 2. What condition does the doctor suspect and why is it a concern? The answer is, the doctor suspects shingles and it's a concern because it's near the eye and could potentially affect her vision. We are already on Conversation 8. Let's take a listen.
Good morning, Mr. Carter. What brings you in today?
Morning, Doc. Well, I've been feeling off lately. My back's been killing me, and it's like every time I move, I feel this shooting pain, like someone's sticking a hot poker right in there.
That sounds uncomfortable. How long have you been dealing with this pain?
Oh, it's been on and off for months, but lately it's gone full tilt. It's like my back's gone on strike.
I see. Have you noticed anything that makes it worse or better? Maybe certain activities or times of the day?
Sitting in the car or standing for too long makes it way worse. Ice packs help a bit, but honestly, I'm at my wit's end. What's going on here, Doc?
From what you've described, it sounds like you could have a herniated disc or some nerve compression. We'll need to confirm that with imaging, likely an MRI.
A herniated disc? Man, that doesn't sound fun. What's the deal with that? Can it be fixed?
It's manageable. Depending on the severity, treatment can range from physical therapy and anti-inflammatory medication to more invasive options like steroid injections. Surgery is a last resort if nothing else works.
Surgery? That's a bit heavy. What would you do if you were in my shoes?
If I were in your situation, I'd start with the least invasive options. Physical therapy is often very effective, and anti-inflammatory medication can help reduce swelling and pain. If the pain doesn't improve after a few weeks, we can explore further options like the injections.
That makes sense. I'm not too keen on surgery unless I absolutely have to. What about over-the-counter meds?
Over-the-counter options like ibuprofen or naproxen can help in the short term, but we may need to prescribe something stronger if the pain is severe. I'll also recommend some exercises to strengthen your core, which can support your back and relieve pressure.
Core exercises, huh? Guess I can't keep putting that off. You're saying there's hope though, right?
Absolutely. With the right approach, most people see significant improvement. The key is sticking to the plan and keeping me updated if anything changes.
Got it, Doc. Let's start with the basics and go from there. Thanks for walking me through it.
Let's check out the answers to our questions for Conversation 8. Question 1. What condition does the doctor suspect Mr. Carter might have? The answer is a herniated disc or nerve compression. Question 2. What treatments does the doctor recommend starting with? The answer is physical therapy, anti-inflammatory medication, and possibly over-the-counter pain relief. It's time for Conversation 9.
Good afternoon, Ms. Rivera. How are you feeling today?
Honestly, doctor, I'm not sure how to even describe it. It's like my body is betraying me. I've been exhausted, but no matter how much I rest, I still feel wiped out. And then there's this buzzing sensation in my legs. It's driving me insane.
I see. Let's take it one step at a time. How long have you been feeling this way?
A few weeks, maybe more. At first, I thought it was just stress from work, but now it's different. It's almost like I don't trust my own body anymore.
That must be very unsettling. Can you tell me more about the buzzing sensation? Is it constant or does it come and go?
It's not constant. It's worse in the evenings. It feels like my legs are alive, like there's electricity running through them. I can't sit still, but moving doesn't really help.
That sounds frustrating. Have you noticed any other symptoms like muscle weakness or changes in your sleep?
Well, my sleep's been awful. I keep waking up, sometimes feeling like my legs jerk on their own. And as for weakness, it's hard to say. I don't feel weak exactly, but I don't feel steady either.
That helps paint a clearer picture. From what you've described, we could be looking at something like restless leg syndrome or even an issue with nerve function. I'd like to run some blood tests to check your iron levels and other markers. We might also consider a nerve conduction study if needed.
Restless legs? I've heard of that, but it sounds so minor. This doesn't feel minor, doctor. It's taking over my life.
I completely understand. While restless leg syndrome might sound simple, it can have a significant impact on your quality of life, especially if it's disrupting your sleep. That's why we take it seriously.
But what if it's something worse? What if it's neurological? Could this be a sign of something like multiple sclerosis?
I hear your concern, and it's completely valid to feel anxious about the unknown. Right now, there's no indication of a condition like multiple sclerosis, but if we see anything in the tests that suggests otherwise, we'll address it immediately. For now, let's focus on the likely causes and start with the appropriate tests.
I suppose that makes sense. It's just hard not to spiral when you don't know what's happening to you.
That's completely understandable, Ms. Rivera. Remember, you're not alone in this. We'll take this step by step, and I'll be here to guide you through whatever we find.
Let's review the questions and answers for our 9th conversation. Question 1. How does Miss Riviera describe the sensation in her legs? The answer is, she describes it as a buzzing or electrical sensation that gets worse in the evenings. Question 2. What test does the doctor suggest to investigate her symptoms? The answer is blood tests to check iron levels and other markers, and potentially a nerve conduction study. Well, you've made it to the final 10th conversation, and this one is a lot more difficult than the others. And to make it even more interesting, I've added a 3rd question for you to consider.
Good morning, Mr. Grant. What brings you in today?
Morning, Doctor. Honestly, I'm at a loss. I've been feeling progressively worse over the last couple of months, and I can't seem to pinpoint what's wrong. I've got this fatigue that just won't quit, even when I sleep well. My hands and feet feel numb sometimes, and lately I've noticed I've been losing weight without trying.
That sounds concerning. Let's break it down. When did the fatigue and numbness first start?
I'd say the fatigue started about 4 months ago, but it wasn't as bad back then. The numbness, maybe 2 months ago. At first, it was just a tingling sensation, but now it's more like complete numbness in my fingers and toes. It comes and goes, but when it's there, it's really unsettling.
I understand. And the weight loss, how significant has it been?
About 15 pounds in the last 2 months. I haven't changed my diet, and honestly, I've been eating less because I don't have much of an appetite.
Have you experienced any other symptoms, like dizziness, difficulty breathing, or changes in your vision?
I do feel lightheaded sometimes, especially if I stand up too quickly. No problems with breathing or vision, though.
And how's your energy level throughout the day?
It's terrible. By mid-morning, I feel like I've hit a wall. I used to exercise regularly, but now even walking around the block feels like too much.
Have you noticed any changes in your skin or unusual bruising?
Actually, yes. My skin's been really dry, and I've noticed a few bruises on my arms and legs that I can't explain.
Based on what you've told me so far, there are a few possibilities we'll need to explore. The combination of fatigue, numbness, weight loss, and unexplained bruising could point to a range of conditions, from a nutritional deficiency to something more systemic, like a blood disorder or autoimmune disease.
A blood disorder? Like cancer?
It's too early to jump to conclusions, Mr. Grant, but we need to rule out serious conditions, including blood cancers like leukemia, as well as autoimmune issues like lupus or even diabetes-related complications.
I see. What's the first step?
We'll start with a comprehensive blood panel to check for anemia, vitamin deficiencies, blood sugar levels, and markers for inflammation or infection. Depending on those results, we may need imaging tests or a referral to a specialist.
How long will it take to get answers?
Blood test results usually take a couple of days. If we need additional tests, like imaging or a biopsy, that could take a bit longer. I'll make sure we move as quickly as possible to figure this out.
I've been trying not to overthink it, but it's hard not to worry. I've felt like I've been slowly falling apart.
I completely understand. This can feel overwhelming, but you've done the right thing by coming in. Let's focus on getting the answers we need. In the meantime, try to eat small, nutrient-rich meals and keep hydrated, even if your appetite isn't great.
Thanks, Doctor. I appreciate it. I just hope we figure this out soon.
We will, Mr. Grant. You're not alone in this, and I'll be here to guide you through every step.
Well done, that was quite a tricky final conversation. Now it's time to check out our questions and answers. Question 1. What symptoms does Mr. Grant describe that concern the doctor? The answer is fatigue, numbness in his hands and feet, unexplained weight loss, lack of appetite, lightheadedness, dry skin, and unexplained bruising. Question 2. What test does the doctor recommend and why? The answer is a comprehensive blood panel to check for anemia, vitamin deficiencies, blood sugar levels, and markers for inflammation or infection. Our final question, question 3. Why does the doctor emphasize ruling out both blood disorders and autoimmune conditions? The answer is because the combination of symptoms, fatigue, numbness, weight loss, bruising, and dry skin, could indicate systemic issues affecting either the blood or immune system, requiring further investigation to identify the cause. And that brings us to the end of our extensive OET listening examination. Well done for completing the entire course. Let me know in the comments which conversation was your favourite and how you got on with the questions. Some of them were really tricky. Student members, don't forget to head over to the membership tab to download your exclusive guide for this lesson, which includes 6 extra questions for each conversation. And you'll also get additional exercises like my new AI homework. If you've enjoyed this lesson on medical English conversation and communication, check out my popular lesson on 500 English phrases for nursing. And if you've enjoyed this video, make sure to drop a like, subscribe, and comment. I'm Jared, this is Learning English Pro, and I'll see you in the next lesson.